Thank you for downloading Children's Pedcast, a conversation about pediatrics with Children's Minnesota. My name is Jimmy Bellamy, and this week my guest is Dr. David Lynch-Salamon, the medical director of the Michael and Ann Cerisi Midwest Fetal Care Center and member of Minnesota Perinatal Physicians. Dr. Lynch-Salamon is here to discuss the technology and treatments in congenital conditions and abnormalities in unborn infants during high-risk pregnancies, and to talk about the grand opening of the Midwest Fetal Care Center's new 6,700 square foot clinic space at the Mother Baby Center in Minneapolis. It's part of a collaboration between Children's Minnesota and Allina Health's Abbott Northwestern Hospital. You can find us just about anywhere a podcast can be heard. We're on iTunes, where you can rate, review, and even subscribe to the show. You can find us on Podbean, Spreaker, YouTube, and Vimeo as well. We're on Twitter at Children'sMN, and you can find us on the web at childrensmn.org. Sit back and listen to episode number 22 with Dr. David Lynch-Salamon. When it comes to the center and its opening, what is now possible that wasn't with the previous version of the center?
What's actually more available now is just space. We've become so busy. I mean, we saw between the Minneapolis and St. Paul campus last year, we saw 900 plus new patients. As of the first couple months of this year, we've seen about 150 new patients here in Minneapolis. So that will annualize out to about 900 just here. So it is busy. And we just needed the space to be able to accommodate the patients and their families, and also the objective of this is to try and bring all the specialists to the family. You know, initially labor and delivery and children's were a couple of blocks apart, and then our office was across the street. Now it's all under one roof. So that's really good, and it allows for the entirety of our office staff, as well as for the specialists that come and will look after the baby after the baby's born, to come and talk to the patients beforehand in one spot.
I imagine that plays a significant role in the outcomes, that you have everybody involved,
yes,
from an earlier stage, and that way there's fewer questions being asked, fewer people being brought in later. What about the work that's being done with some of these other abnormalities for non-twin cases,
right?
Like emphalloceles? What are some of the other things we see coming into the Midwest Fetal Care Center?
This all grew out of, I'm part of Minnesota Perinatal Physicians, which is the perinatal group in Allina, and this is the work we'd always been doing in looking after moms with kids with anomalies. But there was an attempt made in about 2008 to try and centralize all this, to have the specialists come to the patient and just have one place. So that, and then on top of that, we learned fetoscopy to be able to treat the twin-twin transfusion. But the core of this is that we still look after anomalies, brain anomalies and abdominal wall anomalies, and holes in spines and holes in diaphragms, and all these things. But yeah, I mean, there are always going to be questions, but the most important thing about this is to be able to try and coordinate, navigate the care for these families, not just prenatally, but postnatally as well, so that they know what to expect as much as you possibly can. You know, the other thing that is getting much bigger, of course, is the cardiac problem as well, where we have a great pediatric cardiology group that are intimately involved with seeing these patients, and so that we are doing what we have always done. We're now able to do it better in a larger space and be able to accommodate more people and continue the excellent care that we've always given.
When couples are expecting, it's a stressful time, even if everything goes off as hoped.
Oh yeah.
Talk about the role that you've played in helping put people at ease when they're experiencing a scary time, maybe one that to them at the start doesn't have much hope.
Right.
Take me through that entire process, and then to everything being okay, or at least the families having a child that is healthy and well and able to grow up.
I would underline that it's not just me. It's not just one person. It is the totality of everybody who touches the patients, from the front desk to the nurses to the genetic counselors to the sonographers. It's everybody. Certainly I'm the one, if there is something going on, I'm the one that has to tell people about it, and it is stressful. But I think people are pretty strong, and I gain a lot of strength off just the interaction, because if we identify something in a kid that will impact not just the baby but the pregnancy and the lives of this family, it's the start of a journey. And we are part of that journey, and it's not, sometimes it's not perfect because the outcome is not what anybody would want, but we provide the guidance, the coordination to be able to move people through the pregnancy so that the outcome is the best that we can get with what's going on.
A member of our CV team said last year something to the effect of, when you're helping these kids and mending them and making it possible for them to survive, you're making a 70, 80-year investment. And are you able to ever step back and look at that, just the changes that you're creating in people's lives?
I hadn't really thought about it that way. But that's true. We certainly have an intimate knowledge of what's going on prenatally, not as much postnatally because they're out in the world. Mm-hmm. But yes, I do think of that on occasion, and it is one of the reasons why we do this, because we can do that, and we can offer hope. And I think there's always hope, even if the situation is very difficult. I never want to torpedo hope.
Mm-hmm. Do you have any, speaking of hopes, any hopes for specific breakthroughs or things you would like to see in this discipline as far as evolving in the next decade plus?
Well, currently, because of the MOMS trial for spina bifida, there's been an increase in the number of spina bifida cases that have been repaired in utero. It's possible that eventually this, right now we have to actually open the maternal abdomen and open the uterus and expose the baby. It's possible that in the near future that this may be done fetoscopically with just small punctures and not actually opening up with the uterus. There are other things that are being tried. One of the newer pediatric surgeons is Dr. Lilligard, and he is his area of inquiry and study is gene therapy, which is probably the future. That is the future of perinatal medicine. As we identify the genetics that are associated with certain anomalies, there's a possibility it might be able to fix them. I mean, clearly that there are some. There's a reason for everything. Mm-hmm. There's a reason for everything, and what we hope to do is identify what that reason is and try and modify it if possible.
What is it about where we are now, currently, that blows you away? I know you work in it daily, so you see it, but is there anything that stands out that just, wow, I can't believe we can do this?
I can believe it, but the thing that I find that does blow me away is the ability to help moms and kids while the kids are still inside, either by, if we do laser therapy for twin-twin transfusion. We're in the process of developing an open program so we can fix spina bifida in utero. It's been done around the country, but it hasn't been done in the Twin Cities yet. So just that ability to leave the baby where the baby is and allow the pregnancy to continue is it's actually pretty cool.
Talk about early detection. Is everything being found during the ultrasound, and what kinds of things are you looking for?
Well, for twins especially, the twins that we're interested in all twins, of course, but the twins that develop twin transfusions are those kids that actually share a placenta, and about those kids that share a placenta, about 10 to 15% of those will actually develop twin transfusion. There are some signs that we look for, but primarily the best thing is to figure out what the placentation is, whether there's if there are monochorionic or not, and early on, and then you basically keep looking. We look every 2 weeks, starting at 16 weeks, just to make sure that the kids look fine. Because although there are some predictors, a lot of times there are none.
How many cases are we given per year? Is it steadily increasing? And what I've always been curious about is, what communities are we pulling from geographically? Are people coming from other states, traveling a great distance to be here?
We've had one patient that came from Nebraska. We tend to draw mostly from the upper Midwest, Minnesota, sometimes the Dakotas, occasionally Wisconsin. But since we see a lot of twins, we don't operate on a lot of twins because we don't need to. But it doesn't change the fact that we are looking very closely at these twins. And even there are twins that are complicated that we don't need to do surgery on, but are still complicated, that may require more intensive monitoring or even early delivery. So yeah, we're seeing a lot more, so that the number of twins that we are seeing is going up, and the number of procedures that we are doing is also going up.
What about the center has you excited? The space is one thing, but is there a particular part of it that is a nice touch to you?
The waiting room.
Yeah.
Well, it just, to compare and contrast the old waiting room to this one, and in reality, the physical space is important. It's not as important as the people that inhabit that space, both the folks in the clinic and the people that are coming into the clinic. But it provides the room, because what we do can be hard, and it can be impactful, and we now have the room to be able to give people the space, because you need space. You get some news that is life altering, and you need the space to be able to understand it. And even then, you don't understand it. I mean, a lot of times people, if you start talking and you say something's funky, they don't hear much more. Mm-hmm. And we understand that. And there's going to be a lot more questions, and that's where the care coordinators come in. I mean, they're the point of touch for most of these patients, and the care coordinators follow them throughout the pregnancy as well.
When it comes to this center, it's the only one in the upper Midwest. It's one of a few around the country. What makes it stand out compared to the others? Have you been able to travel and see the others, or was the planning process, did that involve any talk about, we'd really like to see this because it works here? The
way that this has worked over the years has been because of cooperativeness, because of involving all parties involved. The prenatal stuff with the perinatologists, the involvement of the subspecialists, and of course the neonatologists that look after these kids a lot of times when they're born. So it has been cooperative, and it's been cooperative throughout a different types of practices. You know, there are private practice groups, and there are practices that are part of Alina or part of Children's, and it has come out of it has worked because everybody is focused on the best outcome for the kids, for the family. That's the best outcome. That's the best. So that we knew that we had to have that in order to go forward. That's the way it needed to work. And we've seen it in other places where it's one institution, so everybody's employed by the institution. So this requires a lot more discussion and cooperativeness. But it is. This is the way we've done it, and this is the way we're going to continue to do it.
And that's one thing that stood out to me in the 2 years I've been here, seeing the collaboration and the cooperation between separate entities. That you have Alina Health, you have Children's Minnesota, you have with the Mother Baby Center and Midwest Fetal Care Center. All of that goes. The one common thread is that they have this shared passion for helping kids and families, and
yep.
and it works. It works wonderfully.
It does.
Can you tell me about life prior to 2008? Prior to the center's existence, was it a little more chaotic than what it is now?
Chaotic is an interesting word. I wouldn't necessarily use the word chaotic, but it was certainly more disparate. It was, you're trying to arrange things and follow up in one of our many clinics, as opposed to having everything more centralized, and that certainly helped families in that they would just come to one place for the care. And sometimes there are people we just see them once. We look, we make a diagnosis or not, and then they go back to their own docs because everything looks fine. But there are some people that we see much more frequently that stay within our practice, and there's some folks that will stay with their primary caregiver and deliver with them. But it's the centralization and the robust development of the care coordination that is the best thing. I mean, yeah, the docs they're good, but the care coordinators, they're the ones that bring things together, and it's everybody. Everybody works to try and do that. But in terms of so that patients don't feel lost and families don't feel lost, they have that contact, and that is extremely important, especially if the journey is uncertain.
And finally, wrapping up, tell me about what families now can do with the Midwest Fetal Care Center that will have a lasting impact. The
Midwest Fetal Care Center is part of the North American Fetal Therapy Network, or NAFNet, and it's a group of centers across the continent that are trying to become more uniform in how we approach things, how we report things, because there are 30 different places, and we sometimes do them 30 different ways. So there's an attempt to try and collect data, and with some of the entities that we follow, can we identify people that don't need to come and deliver down in the city? Can they just stay with their primary care doc outstate and not have to come in for delivery? Yeah, if we can identify those people, that's that. So it might cut down on the driving time for that, but not necessarily coming in for diagnostics.
Okay. Anything else you'd like to add before we go?
No, I would just certainly like to thank the Cerises and our other community partners for really helping us to help all the families that we will continue to see.
And an incredible deal of good being done at the center.
Absolutely.
Dr. David Lynch-Salamon, thank you.
Thank you.